Hi everyone, hope you are keeping well. My name is Sharif Mamdouh. I'm a consultant otolaryngologist and neck surgeon in Ireland. I'm going to give you a quick review about the intercollegiate diploma in otolaryngology and the OSCE course. The purpose of the intercollegiate diploma of otolaryngology head and neck surgery is to test the knowledge and clinical skills, communication skills, and professional attributes for any doctor who is intending to work as a non-consultant hospital doctor in otolaryngology, either in UK or in Ireland. It's not an exit exam. It's an exam for any doctor who is starting his career in the specialty in any of these two countries. And the value for international candidate that the DOHNS Part 2, if combined with MRCS Part A, will help you to register with the General Medical Council in the UK or the Irish Medical Council. If you do full DOHNS and you do Part A of MRCS, you will get dual certificates, which is DOHNS and MRCS ENT. DOHNS Part B or Part 2 exam is an OSCE exam, which means it's a practical and a clinical exam. So the first question, what you should know to do this exam and what are the recommended sources to study? What you should know is the basic knowledge, otology, rhinology, head and neck, pediatrics, and emergency. In otology, you should know the common presentation, how to take history and to perform an examination and to follow a systematic approach to diagnose the case. What are the investigations you will request, how to interpret these investigations, what treatment you recommend according to the British guidelines. Are you aware of surgical anatomy? Are you able to take a proper consent? Are you familiar with the hearing aids or bone anchored hearing aids or cochlear implants? Are you able to deal with emergencies? The same in rhinology. Common conditions, history, clinical examination, systematic approach, investigations, treatment, surgical anatomy, consent, interpretation of the CT scan of the sinuses, and managing any emergency related to rhinology. Same in head and neck. In pediatrics, you should be familiar with congenital conditions. You should be familiar with the underlying embryology, with acquired conditions, pediatric emergencies, and the pediatric airway. And the emergency in any subspecialty is very important topic. And the common emergencies are post-tonsillectomy bleeding, epistaxis, airway emergencies, foreign bodies, facial nerve paralysis, and sudden sensory neural hearing loss. But other than the basic knowledge in the four subspecialties of otolaryngology head and neck surgery, you should remember osteology, instruments, and your clinical performance and your communication skills. Why osteology is important? Because it's very easy. You may find in the exam a bone, either temporal bone or skull or mandible, with marking on the bone and the question. And if you are not ready for this question, you will lose it completely. Instruments, you are a surgeon, should be able to identify the instrument to know what is the usage of this instrument, either in theater or in clinic. And your clinical performance, including history taking, how to perform the examination, what investigations you are going to request. These are very important skills, in addition to communication skills and breaking bad news. Although these things are basics, and it is very important for international candidate because sometimes they don't focus on it before the exam and they may lose marks of different station due to that. So the intended DOHNS OSCE course will focus mainly on teaching and training the candidate on how to perform in the exam to pass it from the first trial. The course will be participant based. The participant should be interactive all over the course. And when you study for this exam, you have to apply strategic way of thinking, of learning. Shouldn't apply superficial way of learning. Shouldn't apply a deep way of learning. You should be strategic, which means you should study, get knowledge, but you should know how to use the knowledge in a proper way to pass the exam. In the course, the candidate will be the focus of the course. The instructor will direct you to study, to practice, and will give you the exam tips. But you are the main player in this course. And if you are not ready to be the main player and to be interactive and to study and to practice and to get the exam tips and to practice how to use it to pass the exam, the course at that time will be useless for you. The course will be delivered over a period of 3 months. Weekly session, each session is 2 to 3 hours. There is a proposed start date in the first week of September if the minimum number of the candidate is confirmed. And the course will be delivered online through one of the online platforms as Zoom or any other platform, which will be decided before starting the course. In the first 2 weeks of the course, we'll discuss otology, history, how to perform examination of the ear and facial nerve. We'll discuss the common conditions in otology, but also we'll discuss osteology of the temporal bone, audiological investigations and how to interpret it, and hearing aids, bone-anchored hearing aid and cochlear implants. It's very important to know these things because definitely in the exam you will find audiograms, hearing aid, cochlear implant, bone-anchored hearing aid, and you have to get the full mark of this question. This is straightforward question if you are ready for it. In the third and fourth weeks, we will discuss rhinology and again history, nasal examination, common rhinologic conditions, and osteology of the skull and the skull base, which also is very important because in the exam you might find the skull and there is pointing on one of the skull base foramina or one of the prominences of the skull base and the question about it. And if you are not ready for such straightforward question, you will lose the mark. Then over the 5th and 6th weeks, we will discuss pediatric otolaryngology, focusing on common congenital conditions, common acquired conditions, pediatric emergencies, and also will give some practice about communication skills and breaking bad news to parents of a pediatric patient. And when we discuss any condition, remember we are doing the exam in either UK or in Ireland, and they are using the British guidelines, so your answers should follow the British guidelines. So it's very important to remember that in every condition you are going to study and in every question you are going to answer in the exam. Week 7 and week 8, week 9 will be for head and neck, starting with history and examination, then approach to a patient with neck mass. Also, we'll discuss thyroid nodule and management of thyroid malignancies according to the British guidelines. We'll discuss the common conditions of the oral cavity, pharynx and larynx. And remember, you may get easy, straightforward question about a photo of a geographic tongue, of rhomboid glossitis, of vocal cord paralysis, and you should be ready to answer this as a spot diagnosis and get the full mark of such questions. Salivary glands and osteology of the mandible will be also discussed during this time period. In the last 3 weeks of the course, we will run 3 mock exams. 1 mock exam every week. Every mock exam will be the same as the real exam, 28 stations. Each one in the real exam is 7 minutes, but in the mock exam we'll make it 5 minutes to train you on how to answer questions in the exam in short time. The mock exams will depend on previous exam questions, and after each exam we'll discuss the answers and we'll work on improving the weak points. By the end of the 12 weeks, you should be able to perform and to answer in the exam as any candidate who is working in the British or the Irish healthcare system. And if you are interested to join the course, you can join this course and book for the course with the MRCS ME Academy. You can Google their website, or you can join the Telegram group and contact the administrators. And if you have any questions, you can put in the Telegram group and we'll be happy to answer your question. And remember, the deadline for booking for the course will be 1 week before the start date of the course. Thank you and the best regards.